Myself and my colleagues who work together at SERSH are delighted to see so many people here this morning.
I myself too like to pay respects to elders both past, present and any elders that could be here today.
To officially launch the Centre for Excellence in Rural Sexual Health online learning modules.
There's not a single area of work that SERSH does autonomously. So this is really a showcase of all of our work together and a quick overview of the work that we've been able to achieve over the last couple of years.
So Bob had sex in 1997. His chance of catching gonorrhea or syphilis would be extremely low.
What is it to be accessible, inclusive and in partnership in your community with people with intellectual disability?
And we go to different places and we run groups for people with all abilities, and we talk about sexual health and abuse.
It's not easy to access abortion, it's not easy to undergo an abortion, it's not fun.
So HIM stands for HPV in young males.
It's been a great day so far. We've just finished up with the peer-to-peer conversation circles.
It's so amazing, and we felt so up there, proud, and and felt big, So it's just beautiful, and we love it.
Face to face with like-minded people to build connections with other organisations that hopefully we can work with in the future.
Pornography might be harmful for young people.
The robot's intelligence is provided through.
We wanted to look at different practical aspects of sexual health care.
Seeing people just a little bit older, they felt they were quite grown up going into this app.
Because they might be socially shamed or stigmatised, or they might feel you're judging them.
We do a lot of talks to young people about accessing our sexual health services.
The best thing for me today was actually the last session, listening to the panel up the front.
The lived experience panellists were extremely invaluable.
I really appreciate all the discussion about diversity in patients, and I think it'll be really helpful to take back as a medical student, but also in my future practice, just how to approach a lot of different patients.
Such a diverse group of practitioners, because there were nurses and the doctors and the youth workers, and then there were so many different practitioners.
It has a really good energy about them, and it's made me excited to sort of go back into the hospital and
hearing how people are targeting, young people and refugees. And
it's been fantastic to see the breadth of the presentations and the diversity of the topics that people have spoken about. We've had 145 people registered. We've had some really interesting discussion.
Centre for Excellence in Rural Sexual Health.
What's women's reproductive choices by ensuring that all women can access health services that provide abortions without fear, intimidation, harassment or obstruction.
A responsive technique where if a community wants us to come and talk about medical abortion, we've gone there.
The Women's, the Fertility Control Clinic, Family Planning Victoria and SERSH came together to develop some training opportunities, not only for rural GPs but the broader health workforce. And the focus of that was to improve pregnancy options and abortion services.
That makes me feel like, yes, work's being done and you can learn a lot from the actual experience.
About abortion and how the program has been implemented here. In my country, in Chile, they are working just in the law right now.
I think the enthusiasm that's created, at a conference like this, that sometimes you work hard and it takes a while to get something off the ground, and then you see other people that are doing and having little successes, and then that takes the enthusiasm, and then and that's what it creates. That's really important.